is Smita Kumar and you're watching Medicircle. Today on Rendezvous with Smita Kumar, we have with us a very interesting personality, Mr. Aamod Wagh, the founder and CEO of TigerTech Labs and TigerTech Smart Living, which is built with a vision to leverage the technologies on the cusp of IoT to bring in the future of smart, safe, and healthy living to the Indian masses. Hi, Aamod, welcome to the show.
Thank you, Smita. Thank you for having me.
So what are the main issues that the healthcare industry is currently facing, and how are they affecting the healthcare delivery process for urban and rural areas?
There are, I think, monumental issues with respect to the healthcare industry that the COVID-19 pandemic has specifically brought upon. Specific examples could be the hospital systems are completely overrun by the pandemic. They are overflowing with patients. There's a huge shortage of qualified staff, which further complicates the issue. You also have the physicians and the medical workers who are suffering casualties due to infections. There are thousands of doctors and medical workers who are infected right now. And there's also a general fear among the population of what we call HAI, which is hospital-acquired infection, due to which, there is a direct impact on many things, like elective surgeries are being postponed. People are going in only for very, very serious issues. You have doctors and medical workers who are unable to visit patients at home for any kind of emergency care. Because of patients also are not very comfortable with that.
Yes.
And medical workers also have the scare of infection. You have chronic patients who need long-term care at home who are not getting any assistance right now because of the same issue. You have prenatal, postnatal issues, expecting mothers who are expected to have their vitals checked on an ongoing basis. They find it difficult to visit their OBGYNs because of the risk of themselves as well as their babies getting infected. You have a large aging population, which is again a serious issue because they are most affected by the pandemic in terms of the risk of infection. And who's going to care for them? They can't be expected to go to hospitals. And last but not least, like you rightly said, I think the rural population has become exceptionally vulnerable, and they face a tremendous amount of issues again because of the shortage of doctors. Doctors are all locked into the COVID hospitals, and there's literally no medical staff available to provide them with healthcare in the remote villages where they currently are. So these are some of the issues that I think we have identified specifically because of the pandemic. And they've become exasperated because of the issues that we face right now.
Why is it important to address these issues quickly and also very much effectively without wasting further time?
I think what we have seen is that we have already crossed a significant threshold. Yes. With respect to the numbers of deaths as well as with the numbers of infections that we currently have. Matters are going to get worse before they get better. Everybody knows that. It is critical to try and figure out how we can fix these issues in the short term, medium term, as well as in the long term. Because unless issues are fixed and systems, telemedicine systems or telehealth systems are deployed quickly on a pan-India level, the spread of the disease, the fatalities are really going to skyrocket. So that is one of the biggest reasons, I think, why we need these issues fixed. And furthermore, the healthcare delivery for the rest of the population, it needs to come on track so that patients who are not affected by COVID, they can at least start receiving attention and care without any risk of infection. I think these are a couple of reasons that I can quickly think of why, it's an urgent matter to fix this ASAP.
Sure. How does TigerTech proposes to address these issues? And where are the market trends that make this a long-term plan?
Um, well, as far as we are concerned, I think the only viable option that we see in terms of continuing to provide world-class healthcare delivery during the pandemic is adoptions of robust and comprehensive, telehealth solutions. Um, Solutions that can use virtual channels, not only for communication, but also to collect patient data and to provide the healthcare delivery. Um, this is literally the only way today that we see to reduce infection for everybody concerned, and also to maximize the utilization and the productivity of the medical staff. Because again, that is an issue with the shortage of staff. You need to make sure that they're utilized in a much better manner as much as possible. So our vision, if you look at it from TigerTech perspective, our vision is to deliver on all the promises of digital health through a very comprehensive telehealth ecosystem. That's what we like to call it, not just a telemedicine solution. What we believe is that such an ecosystem will help to transition the current healthcare delivery processes um, to the telehealth platform, and it'll ensure that hopefully over time that becomes the standard operating platform for all healthcare delivery, regardless of whether it's urban or rural. So that's really what we see happening. In terms of what we want to achieve, um, I think let's look at what does a good telehealth solution consist of or should consist of. According to us, I think the first part is that it has to provide online collection of patient profile information, all the data related to the patient, not only about the symptoms, but also basic data about the patient, including things like lineage. Did any of the parents have a heart disease, for example? That is an important aspect. Are there any pre-existing conditions? Are there any frequent health issues? All of that data has to be kind of captured online, remotely from the patient. It also has to collect the symptoms remotely, obviously. The symptoms come into picture only when the patient is feeling unwell. And the way to collect the symptoms for an ordinary patient who is not really used to medical terminology is to use some kind of a artificial intelligence powered chatbot, a conversational chatbot that will automatically ask specific questions continuously based on a single parameter that you have provided or a single symptom you have provided. It'll keep asking you questions and questions and questions till it finds the right set of answers. And it does what we call a forward triage, where it then presents the doctor with a set of options to say that these are the symptoms and these are some of the things that could be wrong with this particular patient. Based on that, the doctor can then ask more relevant questions in that space. So that is the second thing that a telehealth system should have. The third is a set of connected devices. So today, you can ask symptoms, you can ask patient profile information, but as a doctor, I need to know what your ECG is saying right now. I need to know what your blood sugar level is right now. What is your SpO2 level right now? And there is literally no way of doing that except unless the patient has all of these instruments in the house and they do the measurements and then they provide that information. So the best way would be to have a set of connected devices that connect to the internet, where these devices can be sent to the patient home. The patient can use these devices to very quickly take their vitals. The data is transported to the cloud and then presented to the physician, along with all the patient profile information, along with the symptoms information, so that the doctor is in a much better position to provide a pretty well-informed diagnosis for the patient, and then the prescriptions follow. So that is the third part of the ideal telehealth system. The fourth part should be, utilization of multiple virtual channels like audio or video or chat or whatever for the doctor and patient to communicate. So once the doctor knows what the patient is feeling, what the profile is, there has to be some kind of a call between the doctor and the patient and get more information. So this could be audio, video, or any other virtual channel that can be used between the two. So that is the fourth part. And the last but not least is the availability of some kind of analytic health insights or analytics engines that can help to analyze the various pieces of information that the patient is providing, whether it is the profile information or the test information that is coming on a daily basis, or the symptoms information, and all of it together, it should be able to generate some sort of a health index for the patient. That tells the patient about how healthy he or she is. And this is a great idea for using these kind of systems, even for maintaining the daily health or for preventive healthcare. So that's really what we see as a ideal system going forward. We really believe that this kind of an ecosystem will allow healthcare providers to offer comprehensive patient care without compromising
Also,
on the quality of healthcare delivery.
yes, and
Sorry?
just to interrupt you here, as you were saying about these devices, see, there is one conception for the patients where they are having these wearable IoT devices. And as during discussion, as you said, that these observations are not treated as, I mean, they are not treated as medical information for the doctors to diagnose the patient, whereas in your case, these machines, whatever results or findings they are giving, they can be treated as a parameter to diagnose the patient further. So it is a true
That is
eye-opener. I think in a lot of cases, patients think that whatever these wearable devices like a watches for their heartbeats or for their other vital stats would be able to communicate with the doctor that, see, this is my finding. But the medical professionals are not taking this information. So it is really strange that a lot of people may not be knowing. So they need these physical devices to be having at their homes or wherever they are. So their recordings can be have in that machine, and the same can be shared with the patient and doctor. I mean, it can be done through these web portals and apps where the doctor can directly get the information from the machines.
from the
I
machine.
think it is
Correct.
something like that only.
Very, very right. I think what you're referring, or what I'm referring to when I say connected device, is a medical grade or clinical grade device. It is not a wearable like one of those watches or Fitbits or whatever else that you get today, where it's great for maintaining health, but it is not a medical device. So as a result, if the BP is showing 140 by 110, the doctor is not going to take that as a high blood pressure and immediately come running to your doorstep, because there tend to be so many different parameters are there where the accuracy levels of those wearables is not definitely what we call medical grade. So when I talk connected devices, I'm talking specifically medical grade devices which have been approved, which have been certified by medical authorities to be able to provide clinical grade information. These are the same devices that the doctors could use in their facilities as well. So that's really what we are talking about. But I mean, basically what we are saying is that if we have a system like this, which has all of these parameters, devices, patient platform, analytics, everything put together, the benefits are huge. I mean, it will significantly reduce the caseload on hospitals and physicians, because now the hospital can actually visit the patient rather than the patients having to visit the hospital. It will completely eliminate infection risk for everybody because there is no contact. It will significantly improve patient convenience because now patients can sit at home and get world-class healthcare delivery within their homes. It is significantly again improving doctors' utilization time, because now doctors don't have to spend time in driving to a patient's home or driving back. All the time is completely spent in diagnosis, which is something that they are good at. And most importantly, it like I said earlier, it allows high quality healthcare to be provided to hundreds of remote rural villages where having an on-site doctor currently is almost close to impossible. So, you can have these machines in health camps in the remote villages where all the patients can be scanned for various kinds of vitals or blood tests or heart and lung sounds or whatever it is. That data can be instantly transported to the doctor, and doctor can conduct a long distance consultation, and everybody can get healthcare as if the doctor was physically there. I think that's really what is needed. But what we currently have, I think, is largely the telehealth solutions are focused on video consultations. It is more of a doctor-patient video call All the questioning is done on the video call. And then it is an online pharmacy where the patient says, okay, I will order online my medicines, and that is the end of the story. That is really not what telemedicine is supposed to be. It is starting off today like that, but it has a long way to go. And I think the kind of systems that we are talking about will help us get there. Also, if you look at the current tests, if you have a ECG test that you have to undergo, uh, there are 12 leads that you have to be placed all over your body, all over your chest, etc., which requires full contact with a nurse. Now, that itself again is a huge infection risk. So ideally, you should have a contactless device where there is no nurse required to actually administer the test. You should be able to administer the test yourself. Also, today you have devices that provide you with information. Manually, the information is read on the device and it is typed into some kind of an app. And then that app uploads it to the cloud, and somebody somewhere reads it. Now, there is a tremendous amount of human error that could happen in that case. Also, we have seen in rural areas where you have hundreds of patients, everybody with 120 by 80 BP. It is simply not possible because you can actually put false information there without even testing people, and there is no way of knowing it. So all of these issues are there in the current telemedicine systems that we have. Now, to battle that, what we have done is that we have the REMOS telehealth ecosystem that we have launched. Now, REMOS stands for Remote Healthcare Monitoring System. That is RHEMOS. And we are looking at making that the new normal for telehealth. So in our device or in our ecosystem, literally there are 4 layers that we have. The first layer uses multiple affordable medical grade devices to collect patient health information. And then it transmits the information to the cloud. So we currently have 3 devices already plugged into our system. So first device is, this is our first device, for example. Okay, now a single device like this can basically capture 7 vitals for every patient. This includes your ECG, it includes your respiratory rate, it includes your blood pressure, your heart rate, your blood sugar, your blood oximetry, as well as your body temperature. Everything can be done in less than 3 minutes in terms of time. And the capacity of a single device is to be able to work with 30,000 patients a year, 3,000 patients a month, very, very easily. So this is one of the devices. The other devices we have are related to blood testing. For example, we can do hemoglobin test, HbA1c test, which is diabetes. We can do a lipid profile, which is your total cholesterol, triglycerides, and HDL. All of it can be done by using your smartphone, connecting these devices to your smartphone. And last but not least, we also have a digital stethoscope, which can take care of your heart and lung auscultations very, very easily, again, remotely. So you would have the stethoscope in one location, doctor sitting in the other end, and you would have the doctor listening into the heart and lung sounds remotely without any issue. So the idea is that these devices are, obviously there are CE certified, FDA certified, etc. But they provide hardcore medical information which can be depended upon by the doctors as they sit remotely, and they can depend on the veracity of the information before they make their diagnosis. Also, these devices are designed for self-administration of tests. So there is no contact, there is no nurse or medical assistant who has to come and help me to get these tests done. There is no contact between the patient and anybody else. So the infection risks are absolutely down to zero. And they also, because they don't need medical staff, it significantly reduces the healthcare costs or the staff costs that typically are reasonably large part of any healthcare provider's budget. So that is again a very probably important aspect that we also need to look at from a financial perspective. And if you look at the rural healthcare space, rather than talk to nurses, etc., to go down to some villages, you can have an ASHA worker in a village who can be very easily trained to use these devices, to practice on these devices, and the ASHA worker can actually hold health camps
Yes.
So that is the beauty of this whole concept, that when it comes to spreading healthcare delivery across the country, these are the primary building blocks that you need to do that. And we already have them in place. So these are three devices we already have. We are already looking at adding more devices. The first one on the list is what we call the FHR MHR UA monitor, which is your fetal heart rate, maternal heart rate, and uterine contractions monitor, which is going to be again significantly important more in the rural space, because there's a lot of fatalities that currently happen during pregnancy, and literally for no rhyme or reason. The only thing they need is high quality healthcare. And with these kind of devices, we will be able to provide all of that kind of quality healthcare in the rural villages without having specific doctors present there. So I think that is going to be an important aspect. So like I said, that was the first layer. The second layer in our ecosystem is our cloud platform. So the first job of the cloud platform would be to collect the registration information, their profile information, and also the test data for that particular patient is going straight into that patient record. So it will collect the all this information, then it will collect the symptoms through an AI chatbot, like I mentioned earlier,
Yes.
and it will conduct a forward triage, which all of this is going to put together and now be sent to the doctor to say that now this is your patient. Go ahead and treat the patient. So that was the second layer. The third layer is the live communications layer, where you will have a video call or an audio call with the patient, depending on bandwidth available, which allows you to kind of have question answers and then come to a diagnosis and provide the prescriptions. And while the doctor is providing the diagnosis or asking the questions, all the data about the patient is being displayed right there in front of the doctor for any kind of reference that they want, right? And the last layer is the analytics layer, which again, now there is a significant amount of information for each patient that is already collected. Like I said, the profile, etc., etc. So the analytics engine takes all that information, analyzes it, and generates automatically health insights for the patient, um, which is like a wellness index, which tells the patient how healthy they are on a scale of 1 to 100. So a number like 80 to 100 would mean that you are reasonably healthy. A number between 60 to 80 would mean that you might be feeling healthy, but there is something wrong. It's advised that you see a doctor. 40 to 60 would mean that you definitely need to be in hospital, and below 40 means you need to be in ICU. So this is a very simple methodology for telling a patient. A patient can't read an ECG. A patient can't understand the difference between systolic, diastolic, etc. But they understand the number. And if you tell them that, okay, this number has to be above 80, they know exactly what that means. And it's very easy for them to keep track of their health. Also, from a doctor's perspective, if I'm a doctor looking after, let's say, a ward full of 200 patients, there is no need for me to look at 6 different charts for each patient to figure out who needs emergency care. I can just have a monitor somewhere which is showing the health index, wellness indexes for each one of the patients out there. So the minute the index falls below 80, it will start flashing in red, which will tell the nurses, the patients, or whoever the caregivers are, that these are the patients who really need emergency care because their wellness index is below that particular number. So that is something again which is built in. So overall, I think in conclusion, we will probably be the first telehealth solution to provide a complete and comprehensive system, which is a combination of connected devices, cloud platform, forward triage, and health analytics, all on a single platform. I think that is really where we are coming from. Obviously, I think the question will be asked that, okay, do you provide connectivity to other platforms? Like a lot of hospitals already have invested significant amount of time and money in building their platforms. So yes, of course, we directly connect seamlessly to any other platform that the hospital wants. And we're looking at how we can assist, how we can leverage these kind of systems to assist patients in need. We are also looking to use this from a long-term perspective, more from a healthcare wellness basis, and to detect issues and provide interventions before the illness occurs, not as a post facto
A
set
common
of
phenomena here in India.
exactly. So that is really what we are focused on. And also, again, from a midterm to long term basis, what we are missing today is the concept of personalized healthcare. When you have so much of detailed information at the patient level, it would be that much simpler to be able to provide healthcare that is tailored very uniquely to the individual, to enable quicker, more effective prevention, more effective diagnosis, and better treatment, so that the outcomes, that come out of it would be far better than what you see today. So that is really what we are doing to address the issue, yeah, which is part of your question. The next part was related to the trends, and I think globally we have seen the pandemic has significantly accelerated the acceptance of telehealth as a platform worldwide, not only in India but everywhere in the world. The obvious reason is that it is the only way for risk-free healthcare delivery to be delivered while reducing the spread of the virus to mass populations and to medical staff. In terms of numbers, I think in India, between March and May, we have seen more than 5 crore teleconsultations on various platforms in India. So that is a huge, huge increase. And we are seeing people increasingly embrace this as the new normal. And they have been forced into a situation where they have no option but to embrace this. But once they start using it, they have found it to be as good, as convenient as what they were earlier, should I say, experiencing with the doctor visits. Also, if you look at hospitals, they are leveraging, more and more hospitals are leveraging telemedicine to provide pre-op and post-op care. Like today, if I have a heart surgery, I'm discharged from the hospital, I will still need to be kept under close watch for 2 months. And that is normally done by having a nurse go to your house and take all your vitals maybe 2-3 times a week. Today, it is impossible to do that. So hospitals are now using these kind of systems with devices being sent to patients' home, where the patient can self-administer the test and the hospital can remotely see how well the patient is doing, to make sure that there is no emergency care required or there is no readmission required. And the recovery is going on very, very smoothly. So those are some of the examples. Diagnostic labs also are increasingly using these devices. We have seen that diagnostic labs, they do a lot of COVID tests, and whenever a patient tests positive, the labs offer what they call the COVID isolation package, where they look after the patient for 15 days when the patient is quarantining at home. But today, what is happening is that the patient has to buy a thermometer, they have to buy an oximeter, they have to take their own readings, and they have to enter the readings in the diagnostic labs app. And the doctor will see those readings and will basically do the consult. So that is really the process. So what is happening there is a lot of patients who may have their blood oxygen level falling to less than 90, which is not really a good sign. Those patients largely are scared because of entering the correct data. If they enter 87, chances are that somebody might come and take them to hospital, which they don't want. So they might enter 92 or 93 just because they don't want to go to hospital, which is really not good for them. But it's the human emotion part that takes over. So a lot of these labs are basically looking at, again, leveraging these kind of devices, where they can give the device to the patient for 15 days. The device will automatically take all the vitals, transport the data straight to the diagnostic lab system. So there is no hanky-panky, there is no manual intervention, so to speak, for any kind of false data to be provided. Again, rural healthcare initiatives also are picking this up more and more. Again, not necessarily because of the pandemic only, but they see this as a way forward of generating or rather ensuring a good amount of healthcare can reach the proper audiences as quickly as possible. So that's really where we are. And I would say again, in last but not least, it is literally also promoting the telehealth platforms, basically like this, is the only way to promote what we call multidisciplinary virtual collaborations between physicians, between specialists, between home health clinicians and patients, which earlier was simply not possible. Because now all of them are on the same platform. It is very easy for them to basically see the same patient record and converse with themselves on a very specific case, very, very easily, very, very seamlessly, without exchanging 20,000 emails between each other. So that's really what we are doing to address this issue.
So with TigerTech, one can look forward to a safe, healthy, and secure lifestyle, to innovative products that can actually think and at the end of the day ensure that they simplify their lives significantly. So how strongly do you think that AI is the future? Because the basis of all these devices and this wellness index is somewhere AI. So how strongly do you think that AI or artificial intelligence is the future of healthcare?
Right, right. Yeah, I mean, see, a couple of things here. I mean, over the last many years, not even many years, I would say last 2 or 3 years, we have all seen a very increased awareness among the population about general health, about general fitness, about personal wellness, all over. The number of gyms coming up are, huge. People who have adopted wearable devices to track their own health and number of steps and BP and this and that, again, it is skyrocketed over the last maybe year and a half or 2 years. So what we see is that this is the beginning of a lovely trend towards the preventive healthcare space. People want to keep kind of themselves fit, and they're willing to do whatever it takes to
Yes.
make sure they don't fall sick, which is literally the first step towards preventive healthcare. However, these, like you said earlier, these wearable devices provide very indicative numbers for a very few health vitals, and they do not provide results with medical grade accuracy. And they are also, the devices are not directly connected to the doctors, so that the doctors can immediately view the results if there is an alarm or whatever on an emergency basis. So what we believe is that we should be able to leverage technology to provide every average Indian family with portable, affordable medical devices in their homes that can ensure that the entire family stays healthy by testing themselves regularly at home. So that is really the first step. So like I said earlier, these devices can do 7 vitals, blood tests, heart and lung sound, etc. Um, but in addition to that, um, what we are looking for is that how obviously how we can, these devices will make this happen without any doctor visits, without any hospital visits. The devices also will make sure that all your historical data is always stored on the cloud. So as a user of these devices, I can see how well I'm doing over the last 2 months, 3 months, 6 months for every single reading that I have. um, we also are looking at, again, as a company, we are looking at setting up what we call health monitoring centers. So when these devices are being used by people, I won't say patients, because even normal healthy people can use these devices for preventive health. Every time readings are taken, these readings can be monitored remotely by a team of doctors or specialists or nutritionists, so that in case any one of those readings is slightly off the chart, that team can intervene and proactively come in and say, listen, your blood pressure is a bit high today, you need to kind of take it easy. Or if your sugar levels are high and you are a known diabetic patient, then it's going to kind of give you a second warning to say that, please, take your insulin on time or do whatever it takes to make sure that these levels come in. So these kind of monitoring services are also something that is missing in India, which we hope that with these devices coming in, the centers also kind of will make time. It's time for these kind of centers as well. Also, from an AI perspective, a lot of our devices have AI-based analytics engines built in. So if you look at the entire wellness index that we spoke about earlier, the wellness index is actually derived based on specific AI algorithms that take various parameters into consideration before they actually come up with a number to tell you how healthy you are at any point in time. So AI definitely is the future, not only for healthcare, but for everything literally going forward from a technology standpoint. Um, and what we see currently, I think, is just the beginning of AI as leveraged by healthcare. In the future, there'll be miniature products that can be actually embedded in the body, which are intelligent enough to continue to transmit various pieces of information, and make sure that that
Monitoring
you
the
remain
health
healthy.
systems of the patient.
I'm sorry.
So they would be continuously monitoring the health systems of the patient, because see, it is, if you're, I mean, if you're leaving everything to the patients, it is sometimes the psyche of the patient that they tend to not check whatever is there in the, even if they have these medical devices. So if the patient is critically ill or has some comorbid conditions, there has to be some these kind of IoT devices which can be embedded inside the patient's body, so that the values or whatever parameters, if they are getting very up or very low, it should be automated by through some notifications. I think it is about something next generation healthcare, which AI can bring into India. But talking about rural Indian healthcare, where basic facilities are still at very large, and they don't have these basic fatalities, and there are so many, as you said, there are so many fatalities happening in during pregnancies, and immature babies are born. So these things, I mean, the devices which you are talking of, the next devices which may come into the future from your company, I think it is going to help Indian rural healthcare system go to the next level. And with the help of ASHA workers, I think this can be really achieved. And this is the best thing I liked about the product, because see, everything we are talking about, it is mostly used in urban systems like these medical devices and other things. But yes, if we are going to rural places where we don't have doctors, where actually the assistants and everybody, like those who know how to run the medical device, is actually a doctor and he is catering to the patient, something like this device would really help and save a lot of lives. So here,
Absolutely. We are committed to that.
true. So that is really great about what you and your company is doing. It is really commendable. So I'll just close with one more question of mine, that there is, this new normal. COVID has introduced this new normal to us. So how do you see calm under pressure? Because we have embraced this new normal. Everybody has thought that COVID would go someday, but it is still with us, and we have to learn how to live with COVID. So what is your personal take on
Um, yeah, I mean, COVID definitely has, been a real, I would say, a curse literally for the world. But I would say for the let's say the telemedicine people group that have been trying to promote the concepts, it has accelerated the adoption in a significant manner. So the hurdles that were hitherto seen for telemedicine with doctors and with patients, with both, have fallen by the wayside, because the doctors earlier also saying that till I can meet my patient, till I can touch and feel, I am not comfortable using machines.
that? Yes.
At the same time, the patient also had the same thing. I want to see my doctor physically. Once I see my doctor only, I feel good. That those kind of psychological barriers that were there earlier have now fallen by the wayside, and they're forced into that kind of situation, which is, which has sped up the entire adoption cycles. And obviously the convenience, people are now getting used to the convenience of sitting at home and reaching their doctor rather than drive through the crowds and find parking and then all those kind of things. They find this far better. But now that it is here, and as more and more people adopt these platforms, personally see and enjoy the conveniences that it provides, we believe it is becoming the new normal. So it is not going to be just during the COVID pandemic, but even after the pandemic is over, this will continue, like the work from home concept, which started off with this whole COVID situation. But now people are finding that yes, it works. So a lot of people are going to now stop spending on renting more and more properties or offices. um, there's no point in doing that. So uh, this particular technology will ease the pressures of the healthcare systems. That's the way we see it. As more and more patients leverage it for basic healthcare, while the hospitals can start focusing more on the serious cases and illness cases that need their attention. Just the generic illnesses, cough, cold, fever, etc. Easily done through this platform. That's really how it's going to begin, and that's how it's going to grow. That's the way we see it.
Thank you so much, Aamod, for sharing this insightful views of yours, and especially the wellness index. I think any patient would understand exactly a figure if he is greater than 80, so he's healthy. That's a new concept, because understanding these medical observations is truly very difficult. If you are not a professional, a medical professional, it is really difficult. So
Yeah.
once again, I thank you for coming to Medicircle and sharing your views with us. Thanks.
Thank you so much. Thanks for having me. You have a very safe weekend. All the very best.
Yeah, thanks.